Hey, everybody. Welcome to our Friday show. I'm really excited that we've got a little bit of a change in format for you. We're going to be doing call-ins now. And I'm super excited to let's just kick it off with our first call-in. We've got Vanessa, and let me admit her and we'll see what she's got to say. Hi, Vanessa.
Hello, how are you?
I'm doing very well. How are you?
I'm good. I see I have myself off here. Um,
Do I get to see your lovely face today or
I'm
not?
I'm
That's the
getting ready to,
question.
to show you, but just don't scream because it's not real pretty. Okay,
Don't
yeah,
say
it's not
that.
a
Well,
well.
hello.
I forgot my hair's not done, no makeup and all of that. So
You know what, honey? This is all 100% about you. So you can show up however you like, and I think you look great.
okay, well,
I'm here for you.
thank you.
Well, I understand it's the hip. Is that correct?
That is correct.
Tell me about it. How did it start? What's going on? How's it affecting you? Tell me what I need to know.
Well, it started off over a year ago. I don't know if my back issues was caused by the hip, but eventually I started having the groin pain.
Yeah.
And I thought that something was wrong with my ovaries or something.
Oh,
So,
no.
because I never had pain right in that area, and it just seemed in the an odd place. But eventually, I had the X-rays and all, and it showed that I had the osteoarthritis of the
Mm,
hip. Started getting worse, and um, I am on gabapentin and
mm,
Meloxicam. So I don't
mm,
know if that's really helped. I would say it must have helped because and I was also taking a lot of acetaminophen. Okay.
okay.
Um, so recently I went to the doctor, and also I went to the doctor, and the blood work showed that I had elevated liver enzymes.
Oh, my goodness.
Yeah, so I stopped taking the Meloxicam.
Yeah.
I backed off that and also the acetaminophen because I read that they could elevate your liver enzymes, and that
Yeah.
would keep me from having a surgery until that's
Yeah.
under control. But I do have a doctor's appointment next week, so I'll have that checked out. But at any rate,
Mm,
the pain. It's funny because there are times, like there may be a moment in time when I can walk okay and no, not much pain. I always feel it, but sometimes I can just, like, it's excruciating. In
yeah.
bed, I can feel it. It throbs,
Yeah.
and so I've been not wanting to have this surgery, scared to death.
Oh,
Okay.
no. I'm
Yeah, I
sorry.
mean, yeah, but it looks like
Yeah.
I'm going to have to go ahead and schedule some. Well, I have scheduled something, but I just did that the other day. So
Okay.
that can be
Well, you,
changed.
yeah. Couple more clarifying questions about your life and how it's affecting you, if that's okay.
Sure.
What do you do? Do you work? Are you at home? What do you do?
I am a technician for T-Mobile,
Okay.
and right now I'm working at home just because they've allowed me to.
Yeah.
Because everybody was working from home during COVID, so some people
Right.
got special accommodations to not come back, be it for health reasons or whatever. And
Right.
I've applied for that, and it's still pending because my doctor hasn't been able to get the right information over to the people who are evaluating it. But the reason I need to stay home or would like to stay home is because when I sit down and get up, I can barely walk, and
Oh.
would have to walk through my office holding on to everyone's desk as I tried to make my way to the restroom or something like that, you know. And then there are times when I can get up and it's just minimal pain, but it
Mm.
kind of looks crazy to the people there. I know they're probably thinking, oh, sometimes she's okay, and sometimes she looks like she's about to die. So I don't know if that looks shady or what. Like, is she faking? No one has said that to me, but in my head, that's probably what I would be thinking. But really, um, there are times when it just hurts real bad, and sometimes it doesn't hurt that bad at all. But I
Yeah.
always feel it. I always feel it. It's
Yeah.
just
Even at
sometimes I
night.
can send
Even
even
at,
even when I'm laying in bed and not even
yeah.
moving.
Did
Yeah.
you do physical therapy?
I did some aqua therapy. I
Hmm.
did,
Hmm.
and nothing. That didn't really help. And I also had an injection.
Okay. Tell me
And I
about
and
that. What was that
I
like?
I thought I was cured. I jumped off that table and started walking. I'm like,
And then it all comes
okay, this
back.
is what yeah. And I mean, when I say comes back, like it started coming back the same night, I think, or maybe the
Yeah,
next day.
yeah.
So I was like,
But,
oh, this sucks.
like you mentioned your back earlier, and
Mm-hmm.
the fact that a hip injection, that wouldn't help your back. So
No.
that all this pain is coming from your hip. And then what if you could feel permanently the way that you did right after that injection? When you got off that table and you were feeling good, what would you do with your life if you got that second chance?
I would go off to dinner more. you know.
With
Oh
who?
my goodness. Yeah, that is a good question. My
Okay,
sister's
well, we
calling
can
me.
work on
Yeah.
that. You know how to work the computer if you work for T-Mobile. You could find people to go. All right.
Right.
Well, the first thing I want to tell you is you are obviously a great candidate for total hip replacement.
Yeah.
And let me just summarize that for people watching who maybe aren't as educated as you about this situation. You have severe arthritis of the hip that was
Right.
confirmed by X-ray. You
Mm-hmm.
failed physical therapy with aquatherapy, and this has been going on for more than 3 months. In fact, it's been going on for over a year. You
Correct.
have severe pain, and the pain you have is classic hip pain. It's funny that you thought it was your ovaries. Nobody expects their hip pain to go into their groin, but it sure does. We don't
Yeah.
know why. We don't know why heart pain goes into the arm. We don't know why back pain goes to the outer thigh and butt. And we don't know why hip pain goes to the groin, but it must have to do with the way that we're wired. I always say we're all wired like cheap condos. You just it's the same, but it's not exactly the same for
Right.
everybody.
Right.
Anyway, that's where you are. And so it's time to do the most important thing that any person can do to make sure they have a good result, and that is pick the right surgeon. And the
Correct.
reason I bring this up is 94% of the people pick the wrong surgeon. And you, my dear, gave me a list of surgeons, and your list is unbelievably good. I'm going to show you in a second. But I just
Really?
want to ask you, how'd you get that list? Because you're doing my job and you're doing it well. So how'd you
Oh,
do that?
just
Yeah.
googling, and I did visit a couple of the doctors, and I'm looking at patient reviews. I'm looking at their credentials, um, but more so than the right. Well, along with having the right doctor, the right procedure is also a major concern that I have.
Yes,
And
ma'am.
the doctors that I've selected, they each do something different. One does SuperPATH, one does uh, the robotic.
Right.
One just does the direct anterior.
Hmm.
So I'm not sure at this point even what I think. I'm leaning towards the direct anterior. I was leaning towards the super path at one point. There's only one doctor in the area here that does
Hmm.
that. And I
Yeah.
did have a consultation with him, but because it's so new, I was kind of leery about that.
Yeah. Yeah.
Um, but
Okay. Well,
yeah,
you came to the right place.
good.
This is the kind of stuff we love to talk about. You
Yeah, and
brought
this is
up,
how I found you because I'm Googling all the time. And
yeah,
sometimes it gets confusing because there is so much information. That's why I
I
figured I
know.
needed to speak with somebody. Yeah.
Yeah, well, I appreciate that. Better too much than too little when it comes to information, but on the reverse side, it definitely gets confusing, and
Mm-hmm.
it can be hard to figure all this stuff out. I want to talk about 5 things with you, and 2 of them you already brought up. One of them is the approach, and
Mm-hmm.
there are basically 4 approaches. There's 3 right answers and 1 wrong answer. The wrong approach is the traditional posterior approach, the
Good.
legacy posterior, and it's wrong because they have to damage so much muscle to get into your hip. Your hip is never quite the same. It's a long recovery, and it's just not necessary anymore. So the posterior approach, in my opinion, is the wrong approach. The 3 that are the right approach are the anterior, the SuperPATH, and the direct superior. And you have surgeons on your list who do 2 out of those 3. So those
Mm-hmm.
are very good. We'll talk about those. The
Okay.
second thing you mentioned was the robot. And
Mm-hmm.
the robot is an assistant that you get that assists the surgeon in surgery. Not only does it hold the equipment and gives that surgeon kind of superhuman bionic accuracy, but it
Mm-hmm.
also, and in my opinion, even more importantly, it does a model of your hip and helps that surgeon pick the exact right implant profile out of millions of possibilities. It helps the
Mm.
surgeon pick the one that is optimal for you. And that That's what I want to see, is that you get the best result you can possibly get. So I want to share something with you if I could.
Okay.
I'm going to take your screen. Let's see if this works so that we get on the same image. Hold on a sec. I'm going to show you something, and that is this. Are
Okay.
you looking at my screen now?
I am.
Okay. So how do I find the best hip replacement surgeon in Atlanta? That's where you are, correct?
Mm-hmm.
Hot Atlanta. Thank you.
Yes.
Well, you got some great options there. I'm so excited for you, but let me show you. So this is a checklist that I made, and it has 1, 2, 3, 4, 5, 6 checks. And the last one we talked about already is robotic assistant. We also talked about someone who does one of these anterior, SuperPATH, or direct superior approaches. So we
Okay.
talked about 2 out of these 6. The next
Okay.
thing I want you to think about is, where do they do the surgery?
Mm-hmm.
Because the best surgeon in the worst facility is not going to be the safest result.
Right.
So we want the best surgeon in the best facility for you. And
Correct.
we'll look at that on your list.
Mm-hmm.
Another thing I want people to look at is the surgeon themselves need to be qualified.
Mm-hmm.
And qualified surgeons are fellowship trained in joint reconstruction surgery, and they do at least 200 of these operations a year. And all of them on your list we're going to see meet that criteria.
Mm-hmm.
And then, the satisfaction that you read online is generally more about the office than it is about the surgeon.
Right.
But nobody likes going to a bad office.
Correct.
So all other things being equal, we want to go to a good office. So
Mm-hmm.
we're going to look at the patient satisfaction results online. And then this one's a little bit wonky, but did you know these total hips sometimes have recalls?
You know what? I think I read something about someone's hip being recalled, and I think it had to be replaced.
Yeah,
Because
no,
I'm on a
thank you, ma'am.
blog.
Right?
Yeah.
No, thank you.
Yeah,
So the
exactly.
way to avoid the risk of ever being involved in a recall is to use registry data to find implants that are proven to be good.
Okay.
And that's what we're going to do with you. All right, you ready to look at your list? Can I get a
I
drum
am.
roll? Let's do it. Let's do it. Now, there's a lot of information on here, so I'm going to blow this up so
Yeah,
that
'cause I
I
can't see it.
can focus on it and show you just the parts that are going to be relevant.
Okay.
These are the 4 surgeons whose names you gave me:
Mm-hmm.
Anuj Gupta, Julio Cao, Anil Thomas, and Mark Hanna.
Mm-hmm.
Those guys sound familiar?
Yes.
Is Julia a female?
Yes. Yes. Her
All
name is
right.
actually, yeah, Julia. Yeah, her last name is Cal. Yes.
How? So we got 3 men and a woman, which is
Correct.
nice to have a mix. So
Mm-hmm.
the first of our checklist things is, are they fellowship trained and board certified? They all are.
Mm-hmm.
Wonderful. Where did they do their fellowship? Holy cow, these are some impressive people. We got Yale, we got Harvard, we got New England Baptist in Boston. That's where Harvard is. Hospital for Special Surgery in New York. That's one of the leading orthopedic centers in America. All
Mm.
right, now we're going to get to the first place where somebody's going to drop out. You ready?
Yes.
Robotic assistants. Our first doctor is a no, and that is Dr.
Gupta.
Gupta. He's a no robot. And to me, that's game over. I wouldn't have surgery without the robot, so Gupta's out.
Oh.
Is he the one you scheduled with?
No.
Okay, well, we're still in then. I'm still in the game.
Well, not
Good.
really, but I'll tell you about that later. Let's just continue down the list.
Okay, so Gupta's out because he doesn't use the robot. He does do an anterior approach, but it
Mm-hmm.
doesn't matter. If you don't have the robot, then you don't have that assistance in picking out the implants. So no,
Correct.
thank you. All right, how about the second one? All the other surgeons, all 3 of them, Cow, Thomas, and Hannah, all use the robot. So we're good. We're good there.
No, not really.
Oh, no,
Because
which one? Which one?
Hannah, which is the one I've selected, does not do the robot. I think they have it, but because he's in the same group, resurgence, as Dr. Cal,
Mm-hmm.
and she does do the robot.
Yeah.
However, her, I don't know how this works, but I think she does posterior with the robot.
Yeah, you can use the robot and do the posterior
But
approach.
but but she does not do anterior. That all she
That's
does. Hmm.
that's cow.
Yeah,
Okay, so I got that wrong. I'm going to update my database. Well, they're both out then.
I know.
Okay, that's
I
fine. That's
mean,
fine. All right, so the only one left who does the right approach with the robot is Anil Thomas. Is that correct?
it looks like it. Yeah.
Okay. Anil Thomas, does he use registry proven implants so
That
we
I
can
don't
avoid?
know.
He does. We
Oh, you
called
know
the
it.
off.
Oh,
Yes, ma'am. We called the office and checked. He
oh, okay.
uses striker implants, which are the pattern that he uses is registry proven. How about the facility where he works? Is it at least average and not poor? It is. I looked up, he goes to Northside Hospital as well as Piedmont,
Mm-hmm.
and I looked those up on Hospital Compare, and
Mm-hmm.
both of them are average centers. And
Mm.
average does not mean bad here. Average means
Okay.
good enough for government work. Of course, I would rather it be below average, but most people are not below average, so that's okay. When you're looking at, like, if you were looking at NBA players and said, "Oh, he's just an average NBA player."
Mm-hmm.
Yeah, but he's one of the best basketball players in the world, right?
Right.
So
Right.
that's average does not mean average here. We're average of some very good stuff.
Mm-hmm.
How about his office? Well, his average online score, if you look at ShareCare, US News, Health Grades, WebMD, Vitals, and Google, is actually the highest in the group.
Mm.
So that's the best office, most likely, that there is. And so we've got someone who meets all of our criteria, and that means that's your surgeon.
Dr. Thomas.
Dr. Anil Thomas would now I would say as long as they use the other three. No, you said cow does not use the robot, so I would
She
say,
does. She
oh, she
does
does.
use it,
So
but she does not do the anterior
yeah, so
approach
she's
with
out.
it.
So to me, your only good option is in fact Thomas.
Now, what about how do you feel about the SuperPATH?
SuperPATH is a great approach, and we've got a fair amount of data on it now. So when you compare the three minimally invasive approaches, SuperPATH, direct superior, and anterior, they are equivalent in terms of their published outcomes. Direct anterior has a little bit higher dislocation rate. SuperPath has a little bit faster recovery and lower dislocation, but it's not significant enough to make, it's not enough of a difference to be true. And so you can choose either one.
So which one has the lower dislocation rate?
SuperPath,
SuperPATH is lower than the anterior,
it is
direct anterior. Really?
correct. Yeah.
I was
But it's not significantly lower. It's
mhm.
lower, but it's not, it could just be an artifact. I can tell you in my experience, the surgeons who do SuperPath are incredibly good cutters. And so nobody, if you're not an incredibly good surgeon, you really can't do SuperPath very well. And so it attracts only the very best of the very best. That doesn't mean it's going to be a better outcome for you,
Right.
because the robot brings everybody to about the same level. So to me, when you look at the robot and the robot for the implant selection, and then the advantages of being in a good hospital with a minimally invasive approach, it's a no-brainer. That you've only got one doctor who does all that.
Oh, that's scary because um I had kind of Neil Thomas was my first choice initially because I was reading so much about the SuperPath.
Yeah,
But because of its newness, relatively, I guess, to the others, that kind of steered me away, just knowing
it's
that.
not it's not
Not
newer.
that, really.
Yeah, well, so it's been
What?
around just as long, but it's harder. And so a lot of surgeons have not adopted it. So if it were me, and by the way, there's two people in my first family, two of my five siblings, as well as my mother, so three people who've had hip replacements. So this is
Oh,
something that's personal for me. And
did any of those three have SuperPath?
no, because they were before the robot even.
Oh, okay.
Unfortunately, everybody in my family's too old.
Oh,
But if they had it today and they came to me and they said, let's say you were my mother, which you're too young to be. But let's say you were, I would tell you, Mom, doesn't matter. I would go with those two approaches. SuperPATH is not worse. And it's, by the way, it was invented around the same time as the direct anterior, but because it's more difficult, fewer surgeons do it. And in some ways, it's like you don't have to have the SuperPATH approach, but if you got a surgeon doing it, you got one of the best surgeons. There's just no other, nobody who's not an elite surgeon can do this approach. So I would say, not only would I not view it as a negative, if I would view it as equal, but if it's anything, to be honest, it's a positive. So not an issue. He's also got the highest patient satisfaction, and that's not an absolute. You can have a good doctor in a bad office and people are going to complain, and that's the reality. But you can't have a bad doctor. A good office doesn't make up for a bad doctor.
Right.
So no way, right? So you got a good doctor in a good office. I would not be put off.
Where is the scar on the SuperPATH? Where would the scar be?
Can you show me your bikini?
Can I show you? No.
Yeah, do you wear a bikini? Then no one's going to see it.
No, I can't show you, but it'll be at the bikini line?
Yeah, no, ma'am. The direct anterior approach is in the front, but it goes down the thigh a little bit. Okay. The SuperPATH approach is on the side, but it would be covered up by a bathing suit, is my point. So you're not, the scar is not an issue. It's going to be, if you put your hand on your hip, put it off to your side.
Right.
That's about where the scar is.
Okay. Yeah. So it's not in the back. It's not like
the posterior. In fact, the word posterior actually means back.
Right. And
remember, for everybody else, posterior is not the way to go. So your doctor, who was it for you, Dr. Cow or Dr. Gupta, who was the posterior?
Cow.
Dr. Cow. So no, that's a no-fly zone.
And it's funny, she does that. She does posterior, but she also does the robotic. So I'm just surprised though that she doesn't do the anterior, which she does not do.
I don't want to say anything, but it's usually she's older.
Actually, she's not.
Oh, that's weird.
She's probably the youngest. Well, I don't know for sure. Just based on looks, she looks like she might be the youngest one on my list.
I wouldn't go there.
Dr. Thomas is the youngest one, I think.
Yeah. I'm biased in favor of younger. I'm a retired surgeon. I have to tell you, I'm biased in favor of younger surgeons.
Because they have the most up-to-date techniques. And
none of these other surgeons, who, if you trained more than 10 years ago, you never heard of SuperPATH.
Right.
So these doctors learned, these people coming out today, man, they don't know anything other than how to do it right. And so I really think they're just better. But I don't want to, and that's coming from an old surgeon. Now, I was a spine surgeon, a neurosurgeon, not an orthopedic surgeon. But still, I just feel like you can teach an old dog new tricks, but it's a trick. Like, these younger surgeons were trained how to do these things, that it's normal for them. They're great at it. It's just a walk in the park. I would not let that SuperPATH, SuperPATH is not newer, and I would certainly not let that be a negative. If it's an issue, it's a positive.
Well, if something went wrong with my surgery or with the implant in the future, and say Dr. Thomas was nowhere around, would someone else know how to go in and revise that or do further surgery, or would they just go into a different direction? They would just go in not the same area. They would just put the scar wherever they would normally put it for it, like anterior, for instance.
You just ask the best questions. So let me can I give you a two-part answer?
Mm-hmm.
First, what's the probability of something going wrong and the implant failing? It's 5% at 20 years. So 1 in 20 people are going to have a problem over the next 20 years. So we're talking about something that is extremely unlikely, correct?
Okay. Mm-hmm.
If I told you the odds of winning the lottery were 19 out of 20 over the next 20 years, you'd be doing the lottery.
I would be.
Yes, I would too. So there's no question the odds are very low. And that number comes out of the American and the Australian registries. The American registry is only 10 years old, but it's looking very similar to the Australian registry, which is 20 years old. And
Mhm.
so there's about a 1 in 20 chance of this implant failing within the next 20 years. I'm not going to ask you how old you'll be in 20 years, but I want you to think in your mind about that.
Right.
You got a 95% chance of this question not being relevant for 20 years. So that's number one. Number two, the approach doesn't matter to the revision. So if something were to go wrong and they had to do it again, the approach, anterior, posterior, SuperPATH, and none of that makes any difference when you go to revise it. Once the operation is done, you have a total hip replacement, and the way they got in there makes no difference.
Well, what
So
about the implant itself? Is there a certain
it's the same
implant?
implant. It's the same. It's essentially of the implants that would be done for the implants are engineered for the approach a little bit. Like the anterior, the Stryker makes an implant that's specifically for the anterior. There are some lateral, but on the registry information we have, there's no difference in survival between those implants. And so it's not something to consider and it wouldn't matter.
Hmm. So if you were having this surgery with all things considered, you would go with the SuperPATH in this particular case, based on the differences between the doctors that I've selected.
I would go with Dr. Anil Thomas all day, every day. If I needed this
Wow.
surgery, I would do Dr. Thomas all day, every day. And I would not go. Dr. Gupta doesn't use the robot. Dr. Cow does the wrong approach. Dr. Hanna's a maybe, but all those the other none of the other ones meet my criteria.
Well,
So I
Dr.
would.
Hanna, he doesn't use the robot either.
Oh, I'm sorry.
And
I corrected my database. Thank you for that
yeah,
information. Yeah.
yeah.
So to me, of the four we got, the one no question, I would go to Dr. Thomas.
Well, would that approach help with the leg length discrepancy, a possibility of a leg length discrepancy? Because that happens, and I don't want one leg longer than the other, and it may just be a something that's going to happen anyway, possibly, no matter what approach. But is there
With
one?
the So they used to literally go into the operating room and be like, "Oh, I'll go with like, what
Mm-hmm,
size do you want,
mm-hmm.
doctor?" And you go, 3.5." They literally eyed it. And I mean, I'm sorry, but that's not good enough for 2023. So the way they do it now is they make a model using the robot, a mathematical model of your actual joint. That's why you have to have a CAT scan before you go in. They make a
Mm-hmm,
model of your actual joint, and
mm-hmm.
using that model, they predict the optimal implant to give you the perfect range of motion. It's unlikely that you will have a leg length discrepancy using the robotic predicted optimization, but if you do, you need it because you would rather have the leg length discrepancy than a hip that doesn't move as well as it could. And because you can go get an implant put on the sole of your shoe and
I
make
don't
your
want to
leg,
do that.
you're not going to do
But
it. It's unlikely. I got you. It's unlikely. But if I said to you, okay, I give you two choices. You can have a hip that doesn't really work right, or you can have a leg length discrepancy. If you're smart, you choose none of the above. But
right.
if that wasn't a choice, which
Mm-hmm.
would you choose? I would choose the leg length discrepancy because I need
Right.
a hip that works for me to get out to dinner. And Atlanta's full of good restaurants, so I
Yeah.
want to go. I want to be able to get up and not grimace in pain.
So
And
one of my biggest fears, because there's lots of them, but I would say would be the dislocation factor.
so, what's the risk?
What is the risk?
0.5%.
That's across all procedures, or with the SuperPATH, is
That's
it
with
less? Or
SuperPath. That's with
okay,
SuperPath. SuperPath has the lowest dislocation rate of any of the procedures. And it's a fair question to say to Dr. Thomas, how many dislocations did you have last year? And
right.
the answer should be 0 or 1, but it really should be 0. I mean, I know some surgeons who've never had a dislocation. And then I know some surgeons who get one a year. It's a little bit misleading. And the reason I tell you that is when they used to whack up your hip and cut through all that muscle to do the posterior approach, which
Mm-hmm.
94% of the surgeons are still doing, by the way. But
Mm-hmm.
when they used to do that, they made your hip so weak that it was so likely to dislocate that they gave you permanent restrictions.
Right.
And so on these approaches, like the SuperPATH and the Anterior, there's no permanent restrictions. But as a result, people are horseback riding and scuba diving and doing yoga. And to be honest, it's yoga that has caused most of the dislocations.
I was going to ask about that. And see, that's another thing. I would be probably so afraid to even do any exercising, which I don't do a lot of anyway, but I need to start. So, wow, what a bad time to start after you get a hip replacement,
I
you
I
know?
feel the opposite. I think it's a
Really?
perfect time. It's a perfect time to start. Yeah. But the exercises starts out in therapy and you get comfortable and you
Correct.
get confident. And I'll tell you what gives you confidence to exercise is not having pain. So
Right.
once you get through the operation, most people get rid of their walker within a week and they're on their way. And so that's really what I'd like to see for you.
So I'm not the best swimmer, okay? My sister, as we speak, is getting an in-ground pool installed, okay? She doesn't
Nice,
live far,
nice.
and I anticipate going over there a lot because I can do my exercises in the water, which would be easier on my hip.
Yeah, for
I
sure.
have a fear of getting in that pool, and I mean, like I said, I'm not a great swimmer, but I'm afraid of getting in that pool, getting in the deep end, and something happens to my hip, and I drown because something could happen while I'm swimming. You know,
Are there
that is something.
sharks in the pool?
Only if you pee
Well, don't do that.
in the pool, right?
Yeah, no. So I would tell you the exercise that you want to do in the pool is not swimming, it's walking. And
Right.
so first of all, stay in the shallow end, but second of all, get water wings. They now have them. You wear a vest with the floats. You cannot go underwater. You couldn't get yourself under if you wanted. You don't ever want to be anything but upright. You're not swimming, you're standing.
But
Even
what
if
if
you
I
were in
wanted to swim?
you could, but not at first. So go
Right.
over
Oh
there
yeah,
with
yeah,
the
yeah.
yeah, go over there with the water wings. Go get them before the surgery. Take that
Hmm.
fear off the table. Once you're in that pool and you're walking and you feel confident, then you can, do whatever you want to do. So you don't have to worry about it.
If you're wearing the water wings, and I'm not sure what they are, I better write that down so I can check. Um,
They're just floats
they're just
that
like a
keep you,
floaty,
yeah,
yeah,
floating. Yeah.
like a not like a jacket, like a swim, the old what they used to call the life jackets. It's not
Well,
like
believe it
that.
or not, the new water wings look more like the old life jackets, and it's basically the same thing. But you
Okay.
could you could just wear a life jacket. Oh my gosh, I love talking to you, and you're the best question asker, but I got a bunch of other people waiting, so I'm sorry, but I'm gonna
Well,
have to
that
go.
sucks. I didn't think
I
I would
know.
enjoy talking to you as much as I have. Um,
Oh, thank you for the low
mm,
expectations.
right?
That's
No,
really
no,
sweet of
no,
you.
no, no. It's just because a lot of times one person doesn't know all of the answers. You know what I'm saying? And you
Yeah.
know answers to every question that I've asked, whereas
Well,
one other.
I'm objective. I got no chips in the game. I'm not an orthopedic surgeon. I'm not doing these surgeries for people.
Right,
So I
right.
feel like I can be a little more objective. I hope. I've got no biases. The orthopedic surgeons are certainly more knowledgeable than me. And if I was going to have the surgery, I sure wouldn't go to me. But I think for this, I hope it was helpful for you, dear.
It was. In fact, I hate to do it, but I may have to cancel Dr. Hannah. And it's not scheduled until and I just literally scheduled it 2 days ago.
Well,
And
it's
I'm
fine to
now,
cancel. He won't mind. And call
yeah,
me, call me back and
it's
let me
not
know
till
what
the end of
happens.
April. Yeah, and I'm gonna call Dr. Thomas's office to
Yeah,
see what he can do and what his availability is as
yeah.
far as surgery. Um, okay. Well, I really appreciate it.
All right, dear. It was so nice to meet
And
you today.
you too. I'll talk to you soon, I hope.
Yes, ma'am. Call me
Thank you.
back. Let me know what happens. I'd love to know what
Okay.
happens.
All right.
All right. I'll
Good,
talk to you soon.
goodbye.
Bye now. Oh my gosh. I'm so excited for her. I'm so excited for her. And I'm glad to get that additional information on those other surgeons and we can figure out what to do and who's the best.